Okay, fabulous. It's like we have a nice full house.
We do.
I'm going to throw the slides up. Can you see that?
Not yet.
Good
Not for me.
thing we're troubleshooting.
And if you need, I have them up too, if you need me to share.
I think I'm just being a ninny.
Looks like it's going. Yep, now we can see it.
Okay, full screen, everything good?
It's in the not in the slideshow. It's just more in just a so one more step. That'd be great. So,
Did that work?
not yet.
I can only see myself, so when it goes,
Oh, got it.
if you have it up, maybe
Maybe do it? Sure. I do not mind.
I don't waste everybody's time being.
No, thank you so much for everyone waiting. One sec. Okay, one more sec. All good?
Great. Okay, well then let's get started. Thanks everyone for joining today. My name is Ellie, and I'll be presenting today alongside Nicole Zwick, who is one of our senior evaluators on CPEG. And hopefully you know from the emails that we sent that today we're talking about PSE and the framework that CPEG has developed and plans to implement with you all during this grant cycle. Next slide, please. So before we jump in to the details of the framework, I just wanted to orient everyone to what we'll be covering today. So we're going to do a brief history of how we developed this framework. We're going to provide a detailed description of what goes into each phase of the framework and how it applies to you and your work. We're going to go over what quarterly reporting will look like because it will be different than the past grant cycle. And how the framework really is going to represent your work, in our opinion, in the best way possible, and how it can be uniquely tailored to what you're working on. So that's an overview. So backing up to the origins of this framework, with all the work that CPEG has done with evaluations and with other grantees in the past, it became pretty clear that some programs are easier to represent than others. So programs that have a lot of quantitative metrics or clinical outcomes, that can be represented in a pretty straightforward fashion. But for programs with more difficult to measure outcomes or primarily qualitative data or outcomes that won't become deliverables for perhaps several years, CPEG sort of realized that we needed to make a more nuanced approach to how we capture and represent that work. And our first step sort of down that road was piloting something called the Analysis of Contribution Framework, which comes from the University of Kansas. And CPEG rolled this out, piloted this with STEP grantees during fiscal years 16 through 18. And kind of some lessons learned from that experience, we found that it was very effective in measuring community education and interventions, but didn't necessarily provide as much robust reporting information for policy work. So we took that back, utilized a few other methodologies and the experience of other experts, and developed the PSE framework that we're going to be presenting to you today. And one of the nice things is that you guys are not guinea pigs. We have been using this framework with STEP grantees through their fiscal years 19 and 23. So we do have experience that we know this works and how helpful it can be. Next slide, please. So here's a snapshot of the framework. Not to be too scary, we'll dig into each step as we go. But you'll see that it's divided into 3 major sections. So we have preparation, initiation, and action. And within those stages are smaller steps that make up each stage. And even though it sort of looks like it's a chronological list to accomplish, the framework does not assume that your work is linear, and it really promotes an iterative practice. So when you're completing your reporting, we encourage you to jump in at whatever stage or step is most appropriate to the work you're doing. Like you could be simultaneously, for example, be in the preparation stage, step 1, with identifying and engaging strategic partners. And you also might be in the initiation phase with step 5, assessing decision maker support. So we really love how this framework can be flexible with what you're doing. Next slide, please. And the first step for the grantees when it comes to incorporating this framework into your work is setting goals and benchmarks for each step. So when you built your implementation plans, you already identified a lot of these goals and benchmarks for how you'll know that your program is developing and being implemented in the way that you want it to be. And most likely you already came up with ways of measuring that and how you know that you'll be successful and have met those goals. So, for example, in the preparation stage, and we were in the step for identifying and engaging strategic partners, you would set a goal for yourself to know that you had finished that. So that could be setting the number of partners you want to reach, like you want to have 10 strategic partners, or you want to identify partners from very specific parts of your community. Or it might be more about the level of engagement. So the number of people who are attending meetings. It's up to you and your team to pick those goals. And that way you'll be measuring yourself each quarter to show how much progress you've made towards the goal you've selected. And for reporting, you're going to represent that in 2 ways. So we have a Likert scale that Nicole is going to discuss in detail. That's a 1 through 6, and you can show if you made a little progress, a lot of progress, or completed. But you'll also provide a description. So let's say 1 quarter you actually regressed in progress. You had a 5 last time and you're a 4 this time. You can document that perhaps a community leader who had been instrumental in connecting you with other folks moved, and so you had to take a step back. So the 2 ways of reporting are really complementary and add context so that you're not just getting like a grade on these activities. Alrighty, next slide. Oh, this had the funny feature where you have to like press it multiple times, like undo it. I'm sure everyone is sick of looking at and hearing about SMART goals, but I'm just gonna add in one more time. These goals are specific, measurable, achievable, relevant, and time-bound. And the reason that's important is that when you set your goals and benchmarks for the steps and stages of the framework, if you follow those parameters, it just makes it so much more likely that you'll be able to show concrete progress over time, be able to represent that each quarter that you report, and then be able to say when you've accomplished the goal. So even though this is old news, I really do think it's important. And the goals will show us and your team what you'll be doing, how you'll do it, what we should see as a result, and when we can expect to see those results.
So to really reinstate what Ellie's been saying is this methodology is built on previous work, really to attempt that demonstrate progress in the absence of tangible outcomes or partial tangible outcomes. The steps in our framework really are to describe in such a way to be have a utility and a quality of being relevant to both policy and intervention. So in creating your IP plan, you've identified SMART objectives like Ellie was just talking about and goals that's in your program development and implementation, which includes ways and measures that tell you when you've achieved those steps. This framework asks you to select those key steps and explicitly state your goals and benchmarks that you've reached. So the steps are really grouped into 3 stratas. This is the preparation, the initiation, and the action. However, we're going to keep saying this framework does not assume work is linear. Again, it supports an iterative process, and the grantees are really encouraged to enter the framework at whatever step most accurately reflects the work they are doing. We have provided suggestive mapping using your IP plans and this framework to really help give a reference on how the steps and your objectives with your activities can align. However, these are only guides. You know your project better than anyone. So we suggest you take time to review and modify the mapping that we give you that fits your project. There's really a big advantage to this. This framework is that it really measures that progress based on the grantee's specific overall goals and SMART objectives. So we're keeping in mind that this framework is not linear. We're just going to take the first one to just walk through. We're taking it as the identified and engaging strategic partners. On this slide, you'll see there's evaluation, questions, and indicators of change. These are just suggestive ones. But these are only examples, and there's many that can fit into this step. So, but these are ideas. Like you could identify partners that are in the extended community mobilization. Underserved populations are getting represented. You got voices in the community. You're reaching out to the potential partners. Some of the indicators of change that go with those is the number and types of stakeholders and partners you've really identified and contacted. You've got the number that you've really engaged with and have informal and formal contracts with. So there's many places to use this step. You just need to think of how it works to your project. And to do that, kind of just did a quick, how would I map a couple of things? Trying to navigate different screens. So an example of things that we could map. So for this one, we could say that first identifying engaging partners, the overall objectives is we want to host 6 community listening sessions per jurisdiction within a minimum number of participants being 20. That could be a great starting point. Another one we could do is identify representation of the local health community, the local coalitions, and the community members to be part of a steering committee, and plan to conduct 7 meetings in one year to work on specific policy change work. These are just examples. They just help you give that suggestive mapping for your work to get you started. It can be changed and modified to really fit your work. We're also available to review and answer any questions on how to map your project best. And we suggest only doing like 1 year at a time. That way it's more manageable. But of course, you can map more if you would like. So let's take a look at what the Qualtrics tool partially looks like. There's one block that I apologize is not in this. But this is the first block you would go with is that it would describe, so I apologize, it would describe the overall objective. Many of your projects have about 2 to 4 objectives total for the grant cycle. So this would go for each objective, and then you would pick the steps to go through that objective project. So the very first block would actually be where you could put that overall objective, like identified at least 4 policy changes in a jurisdiction that would improve built-in environment that increased safety to schools. That's your overall objective. You put it in once, it self-populates every time you go into Qualtrics, so you don't have to repeat things. So many of these fields can just self-populate once you enter the data. And then each quarter you can update. So then the next part, you'll see in the brief, see if I don't have my cursor will show you. In this section, in the brief, describe how you will know what you've completed. That's that mapping. This is the area where you're going to map each one, and you can put in all the components that fit your objective of that particular time. So for here, in identifying the engaged strategic partners, you could host 6 community listening sessions per jurisdiction, with a minimum of participants of 20. So sorry, one page, it should be there. Let's see which one I can have. Anyway, so this literally will populate again the next time you go to add in what current status you're at. So please, for the first year, I would encourage to put in all of the mapping in there, even if you can't start it to Q4, or maybe not even to the second year. Just really map it out so that you know where you're planning to go and which steps you're planning to use. And we can help with that again. We'll keep saying that. We can help. So the current status, as you can see, you're going to have this ranking of a 0 to 6. And we're going to talk about in the next slide a little bit of how you can figure that out. But it literally gives you an option of starting it. We have started it all the way to almost completing to completion. And then there is one that you can just put in at not required. Like, this isn't a step that really fits our project. We don't need to do it. That's okay too. There are parts of that. And each quarter, you'll have that qualitative piece where you can actually put in the challenges that come in specifically to the actual activity. And that will be in the section. And it'll at least tell us, like, what's happening. What do you maybe even need help with? We can help you with it. The facilitator is a great spot to actually tell us of successes and things that are working, things that are making things possible to moving that needle. And then it also will always give you an option for, do you want our help on something of this particular step? You can hit a nice little side thing that says, yep, I would like help on this. And then we know exactly what you're focused on and what you need help with. So one of the things that we're going to talk about next is in another example. I figured, multiple examples of this is helpful to kind of go through, and we can have questions at the end and go through this again. So here's another one. So you would have an overall objective, and then you have a progress summary that you get to do every single time that really talks about the overall kind of challenges and barriers and successes that you're having in that objective. So that's what's here. It's giving this, oh, we've really accomplished significant progress in doing so many activities. We've really conducted the focus groups with the school districts and students, and really informed the development of appropriate education materials and would be appealing to the youth. This is that spot where it really can help us get that quantitative piece to your work. So another example of the mapping of identified and engaged strategic partners is here. We did this is secure a commitment of 50% of identified community partners with shared goals for the youth. So in this part of the mapping, we suggest is actually mapping out, when do you know you met that status? When do you know you're halfway through? So for an example here, I would mark it as, I know I'm going to be halfway through and I can do a number 3 if I'm at 25% of that listed engagement of identified community partners that share that goal. Another one for our previous example that hosted 6 community lesson sessions per jurisdiction with a minimum of the number of people of 20, that halfway point could be 3. So that's like, okay, I got 3 community listening sessions. Now I know I get to mark my status at 3. So we can help you map those too. That's part of that whole mapping thing. So you know where you want to progress. So then, and then here you can see how you can add in, you don't always have to have a challenge and you don't always have to have a facilitator. That's just a piece that we encourage you to put if you have it. Next slide. So here is just a really quick snapshot of what you could see at the end of a year. It really is just a quick overview of what progression you've made in those specific steps. Again, not each step is going to have to be done or completed or even started. And they don't have to go in order. You could be an identified community partners doing some mobilization of the community supporters. And you can also be doing other things in the action component too. So this really is not linear in process. And another thing that Ellie had stated is we really know that this work is hard, and going back in status is not a problem. Like, we understand maybe you've lost a champion in the community or partnership, something happened. This system is okay. You can drop back. What it gives you is a place to put the context of it. What happened? So that allows people to understand that there's just the nature of this work is really hard and what happens, and then maybe a strategy for moving forward or getting help for that moving forward strategy, another champion. who maybe somebody knows. So this is, it is not a place to feel bad if you do have just fluctuations in the status part. It's just information. And again, let's keep stating it, not all steps fit all projects. So when you see this, we've even added some to the 9 step, which you'll see at the end, that we're just trying to cater it to different projects. There's a lot of things going on. So this is a visual on the framework that you would actually get to see at the end of the year. It's a really practical way of reporting, and it's a sample of the aggregated activities that really support a standardizing place of framework. At the end of the year, we can look at a graph for each grantee and look at these objectives. Again, as we were stating, most grantees have about 2 to 4, even sometimes more objectives in a grant cycle. So each of these steps in the process would be mapped to an objective 1 or 2, and then to give you clarification how this works. In this example, objective 1 reached in all, they've completed all 3 of their preparation steps. And how I know that is that there's 3 steps and there's 6 points for each getting that completion of status. So that's 18. So when you reach 18 within each of these categories of preparation, initiative, and action, you've completed that stage 100%. So this grantee reached 100% of completion for objective 1 at the preparation stage. In their initiative state, they got 12 out of 18 so far done, and that's about 67%. And then you can see the action is at 11%. And again, these are numbers to show the progress of how policy change and intervention works. It's not to be like you always have to have 100. It's to show the progression of what happens through these stages and what that means to the work you're doing. Again, this data, it really goes beyond just policies being passed. It's really showing the important components that you all are doing in each of these steps. So this is where that importance of this project is. So when we go into these next stages, the preparation we've really worked on trying to expand to give you guys more choices and ways you can actually show your work. The first 3, this is that preparation stage. We identified and showed you the first 3 that you can use. These are the ones we've used for STEP. We've also expanded to give you options to do others in this category. They can be, a lot of you are already doing identified engaging strategic partners, definitely have a lot of technical assistance and in investigating that current situations. We kind of feel like all of you see that work really rich in there. There's also other parts that you really are doing. You're really digging into the target population and finding what to propose and implementing those solutions that are effective and acceptable. Those are really important things to be noting about the work you're doing. So here we just kind of give you, we also have a larger sheet. We just didn't want to overwhelm at the webinar with a big table. It's like, ugh. So each step, we have evaluation questions and we have suggested indicators and metrics that you can use to do that. We can always make more metrics. There's always some more things to cater to what you're doing. So on this sheet, you'll see that the initiative has like a buy-in, a target community buy-in is a really important piece. The other ones have already been used in steps, so that kind of gives you some other things to use. And then you'll see that we've really kind of gave you more expansion on action because we feel like specifically with CCPD grantees, you're doing a lot of action work too, so that we've really worked hard to give you more options there too. This is all available to all of you. It's included in your mapping. We have a mapping, we have the steps, evaluation question, metrics, and then we also offer time to just really work on modifying. We can't tell you what to do, we're just suggesting. So we're going to open up to questions now because we've thrown a lot of material at you. So thank you so much. And I can't see anyone yet. So Ellie, if you do, please fill me in. Reach out.
I don't see anyone yet, and you can also toss things into the chat or just call out. And yes, Stanley.
In terms of how this is done on a quarterly basis, do you kind of set the framework at the beginning and then fill in things as you go along in terms of the progress on these areas? I wasn't sure if it was a separate report or a sequential report.
It is a sequential in some format. But for the easiness of like just being able to do it quarterly, I would go into mapping your first year activities with your IP plan and go, okay, this is what it is. You could just throw those in. You can literally copy and paste your IP, the objectives in there. We're not even asking you to rewrite the language. And then it's in there. And then every time you go in at quarterly, you can go, oh, I started this. Great. Now I can fill it in. And then, yeah, so you can keep kind of doing that. And there's opportunities to change it too. If you, I need to modify that. And so we're hoping that it's a little bit upfront because you want to probably put it in first, just so you know what you're doing for each year. But then quarterly, it should just be more of an update.
Yeah, I like the framework. The challenge that I've always had is you write the grant for 3 to 5 years and you do this statement of work. And then you kind of sit back in year one and say, do I need to do it all in year one or is it spread out?
Right.
And I think the way you're putting it forward allows you to kind of spread it out over time.
Yes. And exactly, like that's why we like the 1 year focus. It's like, and then you maybe see something you put in, and you're like, you know what, we can't get to that till year 2, or we've even changed that direction. Then it can be adjusted for year 2 for that. Yeah. We're hoping that,
Thanks.
yeah, it's a hard policy work. The PSE work is very iterative, I think. It needs a process that really sees that and sees that it's always working, always changing, and what's happening. So we're hoping that's the STEP program is really appreciated that way, for that manner.
Yeah, and I like the way you've progressed on this. I sat in on the CCPD meeting last week and heard like the presentation and previously things were presented in terms of the quantitative analysis and with a sense of common denominator kind of things. And this allows a more comprehensive look at what's going on because there's a lot of, we have about 4 components and it allows for presentation of those different components and how they're coming into place over time. So good.
That's what we were hoping. So it's good to hear that you like that.
Yeah.
Wendy threw a question in the chat and asks, when will Qualtrics be open to enter data? So obviously we didn't do Q1 and Q2 is due January 16th. Is that correct? But I don't know that I don't know that we are doing the same as last year with the same amount of time having it open and closed. Nicole, do you know for sure one way or the other?
That's how we were planning. So it would just be nice to have feedback if that's not doable. Yeah. But also remember that the mapping and what we're kind of giving is literally you can look at, adjust it, figure out what you want, pull it from your IP, and literally could cut and paste from that Excel. Like go, okay, I know this is what I'm going to be doing, and then I know I started this status at this point. The things that you could even make your own columns for the challenges and facilitator ones, so you would already have that information to really cut and paste into the Qualtrics when it's ready. So it's a lot of like, we're trying to make sure it's very seamless, the easiest way of doing it. And again, it's just the first one of each year. It's like kind of like putting all the things in and going, okay, then it self-populates for you. So you don't have to worry about it any other time. It's a good question.
Jody asks, so is this the entirety of the required eval reporting for PSE change grantees? And I assume part of that question is, are we also submitting those raw data sheet templates? This is the extent of the reporting for PSE grantees. You will no longer have to fill out those Excel spreadsheets.
That's the good thing. We may have like a couple of supplement blocks, like there's a overall challenges of the year that we'll do once a year, and there's a couple of things like that. But yes, this is
And we're happy to stay on and answer questions. And you're also welcome to send us an email as you're digesting this information. I'll be distributing the slides and sending links to where this recording can be found again if you want to go back and look over things, and that will help you generate more questions. But this is a great platform where we can do follow-up.
Is someone from CPEG planning on attending our Q1 check-ins? So if we have questions at that point, would that be a good time to discuss, since I know more folks from our project teams will be on those calls?
Absolutely.
Okay.
There'll always at least be at least one of us, hopefully always two. So yeah.
Jody, when you ask for a link to the table, do you mean the tables that you saw in this PowerPoint?
Yeah, the table with each stage and what kinds of questions could potentially go with each of those stages.
Yeah, we will send it to you.
I guess the only other question I have, could you go back to the slide that showed the what the table looks like with the progress summary?
Press summary. Like this one?
Nope.
No.
Like that one. So when you say describe your overall progress, I guess, could you just share a little bit more? It feels a little bit redundant of what we would put in our like own quarterly report that we're submitting to CCPD. So I'm just wondering, how do we make that specific to what you all are asking here and not make it feel like we're just trying to think of like a smaller summary for you all?
That's a great question. So I need to think about that. That's a really good question on breaking it apart. I think it's more of like, if this gives more context of each, it helps us to have a qualitative piece on each objective you're doing. So you guys, because you both all have so many different components, and then what I've seen is the objectives are can be very different throughout the things, right? So it helps us be able to give you that context in the qualitative piece to have it separate. So I know it's more work, but I'll give it a more enriched story to you. And I'm wondering if you could do those little individuals, like smash them down and then submit it to as your main summary overall to CCPD, if that's makes sense. Trying to find a way that's not so much work for you, but also really just want to show your work too. I think is one of our biggest things. We feel like it has been so heavy in the quantitative, and we really just want to work on the qualitative piece too.
Stanley added a question that was not stupid. What is PSE grantee versus our CCPD grantee work? Just want to be sure we're using the right terminology. So I think what you're saying, so we have CCPD grantees, and within that umbrella, we have what we call like direct service grantees that are doing like diabetes prevention and cardiovascular disease. And then we have grantees that are working on policy work, which includes changing the built environment or healthy food and beverage. So there aren't necessary clinical interventions or clinical outcomes. And then we have, I don't know, I'm spacing on it. CSQI.
Yeah.
And so that's how we divide it in our mind, of sort of the work being done and then the metrics being collected. So it might not even be terms that CCPD talks to you all about directly. It might be terms that we use. So that's good for us.
Yeah, that's a good point to clarify. So thank you.
So, what are the next steps then? Do you send this out, and then do we have a timeline for completing this, and do we just kind of create the draft, or do we start filling in what we've accomplished as we go along?
So I think the next step is basically you can review our webinar, kind of see the components, the preparation, all of the options, And then we'll also be sending out the mapping to each of you on what we've mapped your specific project to, and then kind of see what you think there. And then we'll also start doing the quarterly meetings. So that'll be helpful for kind of addressing, really narrowing down that mapping. So that the mapping is really key so that you don't have a lot to have to get to do in January. And then January is just more of that, we'll have another just technical, just making sure how to build that out, kind of Qualtrics. We can do a one-on-one meetings or kind of see what you all would like on that to help you on that process.
So if I have it right, then what you'll be doing is like taking our grant, putting it into this framework, and then having us kind of say that makes sense or
Yep. Yep.
This needs to be changed.
And
Okay.
we've already done that. So we're just kind of refining it a little bit more just to make sure that we feel we've done the very best for you. And then, yeah, it's again, just this is what we as a team thought it fits the best. But again, you know your project and you know what you're doing. So we really want you to modify it, change it, do what you think. So
You haven't sent that out yet, or
not yet. No,
Okay.
we're just doing a little bit.
make sure I'm not missing something.
Nope. That should be coming soon. But we didn't map the status. The status is something we wanted you guys to think about because that kind of feels a little bit, we're suggesting where things fit, not telling you how to do something is the biggest difference we want to make.
Jody, did you have another question?
Yeah, sorry, I always have a bunch of questions. I'm looking at this on the screen and I'm thinking like for the grant that I'm working on in like step 2, for example, we may have more than one measure to know we're there. Is that something that we can do, or can we only have one measure for each thing?
Absolutely. That's a great question. I'm really glad you brought that up. If there's multiple things that you're doing within a step, go for it and put it in. And it reflects, even when you're completing it, it's still a progress of seeing what your work is. So we'll know that you were working on 2 components in that. So yes, that'd be great. And you don't have to put it anywhere different. They can all be in the same one. So you don't have to feel like you're having to separate it out too much. You're like, oh my goodness. So great question.
Another one, will these kind of go hand in hand with our quarterly reviews in with CDPHE, or do they kind of remain separate, or how will that fit in?
Are you talking about like more timing of when you're reporting it, or how would they
Both, because we have a quarterly review with
Right.
Macy in terms of kind of going through our statement of work and reporting on that and providing updates to certain questions there. So that's
right?
a document that we just submitted for this quarter.
Mhm.
And so will this kind of go along with that report, or are we submitting in separate
It'll
places?
be separate places, but we are trying this year to really have a collaboration of all of us. So we will be all on the calls for the quarterly. We will also make sure that our communication with CCPD of where the progress is, so they know where you're at too within our system. So yes, there's more of synergy of information being shared, but it is 2 separate reporting systems. So that is so. Yeah, that's why we're hoping to make this very seam drop in, get to update your Qualtrics really quick, and then it's like, oh, good. And then again, that you made a really good point that was brought up of like even the progress summary. Hopefully there's a way that you can use it for both. If you can give us the individual and maybe like compile it for the overall summary for CCPD. It is not. Hopefully we're, again, evaluation plan that you're doing for your project, hopefully has more of a complementary work to showing your project in a different way so that we can come together and kind of share two different overall, not different, but this is more of ours is the overall evaluation of your program. And hopefully you're picking specific objectives for your evaluation plan that you really want to dive in a little bit deeper and find out what's going on. That helps. I throw that to Ellie too, because Ellie explains it so nicely. So
No, I thought that was great. Yeah. The question was, in case anyone didn't see the chat, this
Oh,
isn't
thank you.
related to our evaluation plan, right? So those are two separate things. As Nicole said, ours is more overarching and yours is a deep dive because you're the experts on your work.
See, I knew you had a great way of that's what I was hoping to say.
So is there a separate evaluation plan report, or does this serve as that progress towards that report, towards what you put forth as the evaluation?
When we're talking about the grantee-led evaluation plan, that is separate, and that's working with CCPD. When it's the program evaluation of your project, that would be ours. That's it's kind of almost like a terminology different, like we're just explaining which the terms are kind of get a little hard to decipher which is which. So I think all of you have submitted a grantee-led evaluation plan to CCPD just recently. That would be to CCPD. So this is the
So
overall.
what kind of happens with that now that we've done it? Is that
CCPD.
something?
Yeah, they'll work with you on it and have you led. And we're hoping to, whatever you have in there, we would love to integrate and just to see that full picture of what you're doing. And that deeper dive can be used into, seeing what you're doing. And maybe like you're reaching the target population. How did you specifically do it? You dove into how to reach that underserved population, and you have more rich information of how what you could do that. Then we would love to actually talk to you and have that. That's something we can give context when we say, wow, they've really had great reach and identifying and engaging partners of the community. Like, what were they successful? Oh, and then they did this grantee-led evaluation, and they were able to really show you how they went deeper into it. And so that's kind of where we're hoping that complementary work is coming into play.
Yeah, it's important to understand because in the past, when we've submitted our quarterly report, the discussion at the meeting tends to focus on that in terms of, ours is Macy Lyons, and she'll review our report and then ask questions about it. But it's not really integrated into the evaluation plan or something like this. So is there going to be kind of a change in the format of those calls?
Not quite sure moving forward yet. That was up to what CCPD would love to do. And I think we had.
I was going to say, I know that Sanjay is on the call. I'm not sure.
Yep,
Don't want to
Sanjay.
put you
They
on the
may have more
spot.
insight. We're hoping to have more collaborative work and talking about these things. And I think they do too. Exactly how that would look, we're gonna follow there. Yep, thank you. Sanjay's getting off mute.
No, I also
Sharing
I know Andrea was on the call earlier. I'm not sure if she's still here and she can help chime in, but hopefully, if I'm understanding your question correctly, there's not going to be much of a change. It's just going to be a small addition to those quarterly check-in calls. I would reach out to Maisie and just confirm to make sure that you're on the same page before that. But I wouldn't anticipate being a completely different process or, experience for those calls.
Yeah, because it kind of looks like we have 3 streams going, and be nice to integrate those into, kind of a big picture.
Yeah. Mirroring what CPEG has communicated here. We're doing our best to really integrate it and try and streamline the process so that you're not doing a bunch of, redundant work. So we will keep all of that in mind as we continue to plan and build out this new evaluation process.
Hi, it's Andrea. I am still here. Thank you, Nicole and Ellie. Great job. Hi, Stan. So as of right now, we're still planning on using those quarterly calls. So for those of you who are less familiar, you should have them actually coming up like any day now with our quarterly one progress reporting. And so we have our program officers on the CCPD team, and our program staff, which might be like subject matter experts or others, join a call with all of our grantees to talk about the progress of the work and all the reporting that you submitted. So the purpose of those are really to check in on how the project's going along, see if there's any ways we can support you to align with other grantees or other efforts, discuss any barriers or facilitators that you're running into and whatnot. And we're lucky that the CPEG team, they are going to join, like Nicole and Ellie were saying. So we'll have at least one CPEG person on each of those calls. So we're trying to do a better job of aligning the evaluation and the progress reporting. So yes, there's some overlap. I think it might have been Kayla that said it earlier of like, a lot of this is the same as what's in the implementation plan, and it is because we want to talk about how the project's being implemented and the progress, but CPEG also wants to capture in whatever form they can the progress that you're making to prove to all of the funders and the stakeholders what great work is happening. So all of the things that you guys are doing that might be more qualitative. So open to all ideas as we kind of figure this out and navigate this with all of you. So once we get through these like first Q1 and maybe Q2 calls, if you guys have ideas on how we can better align and integrate our work between CDPHE staff and CPEG. I know both teams are all open to this, but we're still just kind of figuring it out as we go. But the call format should stay about the same. But CPEG will share the progress and the reporting they get from their system, this information that they just shared with us. So we'll have all that and we share your progress reports with them too. So we just want it to be a robust and fruitful conversation. So like I said, open to all ideas and feedback as we kind of work through this.
Thank you.
It was long-winded. I'm sorry.
No,
I don't know if I
it's
really
good.
answered anything, but we're trying.
I thought you did a great job. Thank you.
So you will have these slides and recording available because I
Yes.
think I'm the only one from our site. So I'll
Yes.
meet with them this afternoon, go over this. And
Great.
I will send a follow-up email to everyone with all the information, and I'm actually going to maybe summarize from the discussion you had with Nicole, the next steps everyone can anticipate. So we'll all stay on the same page.
good. Thank you.
Mhm.
Great. Thank you so much for everyone's time. Yeah, this is a great conversation.
Yep.
We're always available to talk and through email, can jump on Zoom, just let us know.
Everyone can have 7 minutes left to finish lunch.
Or start. I might have to start.
Great. Bye, guys. Thank you all so much.
You may want to stop the recording. I think it's good now, right?
Okay.